We understand that Medicare can be complicated. You likely have questions about what kind of coverage and plan may be right for you. So we're here to answer your questions because we want to make sure you have the information you need to choose the plan that makes you feel truly cared for. And the right plan should do more than fit your health needs. It should also fit your budget. That's why Aetna offers affordable coverage to help you keep costs low. In fact, we offer plans with monthly premiums as low as $0, and there's a limit on your out-of-pocket costs, along with essential benefits such as dental, vision, and hearing coverage. Managing your health as you age can be a big job. It takes a team effort. That's why we offer a variety of Aetna Medicare Advantage plans designed to surround you with a network of hospitals, clinics, doctors, and specialists. And each is ready to deliver the expert care and support you deserve. From encouraging you to achieve your health goals to helping you manage chronic conditions, Aetna is with you every step of the way. Plus, we can help determine if you qualify for the Federal Extra Help Program and more. So when you have questions, we're here with clear answers. And we have Spanish-speaking customer support. Now is a great time to find the plan that best fits your needs. Let's make healthier happen together. Welcome to today's seminar. Aetna takes pride in giving our Medicare members the benefits, resources, and constant support they need to achieve their best health possible. We're here with the guidance and answers you need. Our goal today is to help you better understand Medicare, Medicare Advantage, and other important things you'll want to know as you decide which plan is the right fit for you. We'll cover the different parts of Medicare and how to enroll. Then, we'll have some time at the end to answer any questions you may have. Let's talk about Medicare. Medicare is made up of 4 benefit parts: A, B, C, and D. Parts A and B make up Original Medicare, which is provided by the government. Part A is your hospital coverage, which covers services like inpatient care, skilled nursing facility care, hospice care, and home health care. Part B is your medical coverage. It covers things like doctor visits, outpatient and home health care, and medical equipment. Part B usually requires you to pay a premium, which is deducted from your Social Security check. Parts A, C, and D may also require you to pay a premium. Part C plans are Medicare Advantage plans, which are run by private insurance companies like Aetna. These plans replace Original Medicare by providing both Part A and Part B benefits and more. We'll talk more about Medicare Advantage plans next. Part D plans offer prescription drug coverage, which can provide savings. You can get Part D on its own, or by choosing a Medicare Advantage plan that includes Part D coverage. Medicare Advantage, Part C plans are known as all-in-one healthcare coverage. They include Medicare Part A and Part B benefits, plus other useful coverage. Medicare Advantage prescription drug plans are similar to Medicare Advantage plans, except that a Medicare Advantage prescription drug plan includes a prescription drug benefit. These plans are administered by private Medicare-approved companies with government contracts like Aetna, and often include added coverage like dental, vision, hearing, and fitness benefits. If you need more coverage than you're getting from Original Medicare, but don't need prescription drug coverage, a Medicare Advantage plan could be the ideal solution. Some may already have prescription drug coverage from Veterans Affairs, a state pharmaceutical assistance program, or a union or group retiree plan. There are 3 kinds of Medicare Advantage plans Aetna may offer in your area. For each, you'll use providers in that plan's network. Preferred provider organization plans let you use providers and hospitals out of the plan's network, but you might have a higher out-of-pocket cost. In most cases, you do not need a referral to see a specialist. Health maintenance organization plans give you access to a network of doctors and hospitals. Your plan requires you to only use these network providers. You might also be required to have a primary care provider and need a referral to see a specialist. With health maintenance organization with a point of service plans, you may go out of the network for certain services. For example, some plans allow out-of-network coverage for dental care. These plans often have a higher copay or coinsurance when getting out-of-network care. Going out-of-network may also require a referral from your primary care provider. Understanding all these different kinds of Medicare Advantage plans will help you choose the right one for your needs. A Medicare Special Needs Plan is a specific type of Medicare Advantage plan designed for people with certain health conditions, limited incomes, or who require extra support with care. These plans offer the standard Medicare benefits: Part A for hospital, Part B for doctor visits, and Part D for prescription drug coverage. However, Medicare Advantage Special Needs Plans also tailor their benefits, doctor networks, and drug formularies to better serve the unique health needs of their members. There are 3 types of Medicare Advantage Special Needs Plans offered by Aetna: dual-eligible special needs plans, chronic condition special needs plans, and institutional special needs plans. Dual-eligible special needs plans are for people who qualify for both Medicare and Medicaid. Chronic condition special needs plans are for those who have one or more qualifying chronic conditions like diabetes or chronic heart failure. And institutional special needs plans are for Medicare members who require long-term care, as in more than 90 days, in a skilled nursing facility. As you can see, these plans are designed for different needs. We can help you check if you qualify for one of these plans. Question 1. What is your current Medicare coverage? A. I don't have Medicare coverage yet. B. I have original Medicare. C. I have a Medicare Advantage plan. D. I have a prescription drug or Part D plan. E. I don't know or I'm unsure. Okay, let's get into prescription drug coverage or Medicare Part D. As a reminder, we want to share updates on the 2026 drug coverage limits. The member out-of-pocket for drug costs are now capped at $2,100. After that, you will automatically enter the catastrophic coverage phase and will pay $0 for covered prescription drugs. Any type of insulins that are in the formulary, approved drug list, will cost a maximum of $35. Please take some time to review this important information in your 2026 plan documents to ensure you are aware of how these changes may impact you. Now that we know more about the changes in place, let's take a closer look at how drug phases work. Knowing the 3 phases of prescription drug coverage will be helpful to you. Phase 1 is the deductible phase. You'll be in this phase until you reach $615 in out-of-pocket costs. During this deductible phase, you'll pay the full discounted costs of formulary drugs. Note that if your plan does not have a Part D deductible, you will move directly to the initial coverage phase. With some plans, the deductible does not apply to certain drug tiers, so be sure to check your evidence of coverage for coverage details. Phase 2 is the initial coverage phase. After you reach your deductible, you'll only pay a copay or coinsurance as part of the drug cost until you reach the annual out-of-pocket cost of $2,100. Phase 3 is catastrophic coverage. In this phase, Part D covered drugs will cost $0. Now that we've covered the basics of prescription drug coverage, let's talk about the pharmacy network. Aetna has over 65,000 in-network pharmacies. More than 23,500 offer preferred cost sharing. This means that getting your prescriptions filled is convenient and even more affordable. Finding a network pharmacy close by is easy. Just check our provider search at aetna.com/Medicare. Please note that dual-eligible special needs plan members aren't subject to a preferred network to get the lowest drug costs. Let's take a closer look at our formularies. Formularies are lists of drugs covered by your Medicare plan. Before enrolling, it's a good idea to review your desired plan's information to make sure your prescriptions are covered in the drug formulary. Keep in mind, these lists, pharmacies, and providers can change, so it's important that you check the formulary to verify your medicines and the group that they're in before starting or refilling a prescription. You can view our formularies at aetna.com/Medicare. It's important for you to have creditable prescription drug coverage. That means coverage that's as good as or better than what Medicare pays. A late enrollment penalty may occur if you enroll in Part D drug coverage after your initial enrollment period is over. This may also apply to you if there is a period of 63 days or more in a row when you don't have Part D or other creditable prescription drug coverage. As a reminder, if you have accrued this penalty and you switch plans, the penalty will follow you to your new plan. You can avoid this penalty if you receive extra help. Extra Help is a federal Medicare program that helps pay some Medicare prescription drug plan costs, which may include monthly plan premiums, yearly deductible, coinsurance, and copays. If you qualify for Extra Help, you may pay $0 for prescription drug deductibles and premiums. Extra Help is estimated to be worth about $6,200 per year. Having limited income and resources shouldn't keep you from having drug coverage options. To see if you qualify for Extra Help, call 1-800-MEDICARE 24 hours a day, 7 days a week, or visit Medicare.gov. Now that you understand Medicare, it's time to learn about enrollment. Question 2. What type of Medicare coverage are you most interested in? A. Medicare Advantage plan with drug coverage. B. Medicare Advantage plan without drug coverage. C. Part D drug plan. D. I don't know or I'm unsure. In most cases, you can only enroll in a Medicare Advantage plan during specific times of the year. The main enrollment time is the annual enrollment period. This is when anyone eligible for Medicare can enroll in or disenroll from a Medicare plan. If you are enrolled in other plans, you should talk to your plan broker before enrolling in a new Medicare Advantage plan. In some cases, joining a Medicare Advantage plan might cause you to lose your other coverage. The annual enrollment period runs from October 15th to December 7th each year. Coverage then begins January 1st of the following year. The initial enrollment period is the 7-month period that begins 3 months before you turn 65. It also includes the month you turn 65 and ends 3 months after the month you turn 65. However, this timing could be different if your birthday is on the 1st of the month. Please visit Medicare.gov for more details. If you want more information about Medicare and your options, you can download an enrollment kit. Inside this kit, you should find a Get Started section that explains all you need to consider before choosing your plan, a Medicare 101 section that explains the Medicare essentials you should know, a Summary of Benefits section that provides a summary of your benefits and a general understanding of your coverage and responsibilities. For details, refer to the plan's Evidence of Coverage document. A Medicare Star Rating section to learn about Medicare Star Ratings. We'll cover more about this on the next slide. Medicare Star Ratings let you know about a plan's quality. Each year, Medicare rates health and prescription drug plans based on a 5-star quality rating system. The Centers for Medicare and Medicaid Services, or CMS, rates plans on a scale of 1 to 5 stars, with 5 stars being the highest quality. They use information from member satisfaction surveys, health plans, and healthcare providers to give overall performance star ratings to plans. CMS star ratings can help you compare plans based on quality and performance. To find the star ratings for other Aetna plans available in your area, just visit Aetna.com/Medicare. Once you enroll in an Aetna plan, you'll receive your member ID card in the mail. It has the basic information you and your providers need, like your member ID number and important phone numbers. These include our customer support numbers and 24-hour nurse line, so you can get answers to your health and benefit questions anytime you need them. Your card also includes a QR code that you can scan with your phone to reach specific plan information and to access your documents. Question 3. Would you like us to follow up with you to answer your questions or help you sign up? A. Yes, by phone. B. Yes, by email. C. Yes, by phone or email. D. No, I don't want any follow-up. Question 4. Did you find today's seminar educational and helpful? A. Very helpful. B. Somewhat helpful. C. Neutral. D. Not very helpful. Thank you so much for attending. We hope you learned more about Medicare Advantage and how choosing an Aetna plan may be the right decision for you. If anyone has any questions, we'll be happy to answer them.